Hello, everybody. Thank you for joining us. It is a big privilege for me and excitement for me to have Dr. Angela Kate Gofford with us today. And she's going to talk about a very important issue of unrevealing the biases in ourselves and others. And this meeting couldn't have happened if many factors were not aligned together. Like we had the pandemic of COVID-19 that taught us many lessons, and one of them that it's okay to use Zoom and digital media to have lessons and classes. So this opened the opportunity. The second thing is that Dr. Gofford were positive about talking with first-year nursing students in English, foreign language for the students. And it's kind of a miracle. Thank you for that. And the other part of this all exciting meeting is the cooperation of Dr. Professor Eli Lewis, the Vice Dean of Teaching and Medical Education, and Dr. Aryeh Kaufman, the head of Privas Center for Medical Education. So all this happened together, and here we are finally having this meeting. Before I give the stage to Dr. Gofford, I want to thank you, students and colleagues, for attending this meeting and believing that this is an important issue for healthcare settings and person taking care of patients. On a technical note, because it is in English, and I know some of you will be more comfortable in Hebrew, please feel free. I'm going to be in charge on the chat. So feel free to write on chat any questions you want to ask in Hebrew. We will translate it, or any remarks. We are going to make an effort. Angela is going to talk slowly, and we're going to make an effort that everything is clear. And I'm sure you're going to have a phenomenal session today. And I'm happy to give you the stage. Angela, the stage is yours. Thank you. You just need to unmute yourself.
Thank you. I muted myself to be respectful of your comments, so thank you. Well, shalom. Thank you for having me this morning. It is my honor to be with you all. I'm very excited to be here. I wish I was there. I have not been to Israel before, and so I wish I was visiting you, and maybe I will come to visit you in a future year, but I'm happy to be on the computer with you this morning. So thank you for having me. We're going to be talking about a few important topics today, and a few topics that I think are difficult to talk about and sometimes challenging to talk about, hard to talk about. But I think that hopefully we'll reach some understanding together and learn a little bit more about ourselves and learn a little bit more about each other. And the goal of today is really to help all of you take better care of the patients that you're taking care of. And so that's really the ultimate end outcome that we're hoping for, is that we can all learn together how to take better care of patients. So to prepare for today, there was an activity that was sent out ahead of time. And it was an assignment called I Am From, in which each of you were to write a little bit about yourselves in a different format. So rather than introducing yourself to someone by saying, this is my name, or this is my name, this is what I'm studying, we asked you to think a little bit more about who you are and where you come from, the customs, the people, the places, the music, the traditions that you come from, and to write some of those things down. So how we are going to start this morning is to put everybody into breakout groups with a few of your colleagues to share that story that you wrote down with each other. And while you're reading your story, the directions for the breakout room are that one person at a time will read their story to the other people in the room. And when that person finishes, then the next person will read their story. We're going to take about 10 minutes to do this activity. So depending on how many people are in the room, not everyone might get a chance to read their story, but hopefully you will be able to hear 2 or 3 stories from the people who are in the room. So while you're listening to the stories, what I want you to think about is what surprises you about the story that you're hearing from someone else. What's the same as your own story? And what's different from your own story? And so Alana's going to break us into breakout sessions now. And then when we come back, we'll talk a little bit about what that was like for all of you. So.
I just want to be sure that everybody understands the assignment. Please let me show of heads that everything is clear. I just want to, great. I just want to be sure that if there is someone that did not make this assignment, and I believe there will be some, please look at the worksheet that I sent to you and address what Angela wrote, and maybe think about a thing or two that you might think about yourself, and then share it, okay? So if you have your assignment done, please use it. And if not, this is an alternative. And I'll be touring to help. Angela, I think you can go in and out rooms also, because you are a co-host, if you want to visit breakout rooms.
Okay.
Do you want me to take time? Or you are on the time?
Why don't you keep the time?
I'll keep the time. Okay. We are talking about 10 minutes?
Yeah, that sounds good.
Mm-hmm. Angela, I'm going to close the rooms in a minute. I'm going to close it now, and they have 60 seconds to wrap up. Hi, Smadar.
מה זה, אילנה, כולם צריכים להיות
לא, לא, את לא צריכה להיות בקבוצה, זה בסדר.
תודה לך.
זה לסטודנטים. את יכולה, אבל...
לא. אני אוותר.
אוקיי.
ילדת יום הולדת.
תכף, תודה. תכף אנחנו מתחילים.
בסדר גמור.
Angela, we can start now.
Okay.
Everybody.
Everybody's back.
Yeah.
Okay, great. Welcome back, everyone. I hope that that experience went okay for you. I'd like to hear from all of you a little bit about how that experience went for you. And the way that we're going to do that, because we have a large group of over 100 people, is that I'm going to ask you to use the annotation feature on the Zoom. So if you hover over your Zoom controls, there should be a button that says annotate. And if you click on it, then you should be able to put check marks and other things on the screen, stars, hearts, things like that. So there, I see some of you putting those on there now. So the first question that I want you to answer is reflect on this statement. I learned something about my peer. And what I'd like you to do is put on this line, yes or no, I learned something about the person who I was in the room with. And so you can see the annotation starting to fill the screen there. So it seems like most people are indicating that they did learn something about the people in the room. All right, so I'm going to have you pause there, and we're going to answer another question. The next question is coming up here. I'm going to close my annotation. I felt vulnerable or nervous while I was reading my poem. Yes or no? Some people are really going for it there with their drawing. All right, so that one, we have a little bit more of a spectrum. Some people did feel nervous, some people did not feel nervous. All right, I'm going to clear that, and we're going to do one more question here. And the next question is, I felt more connected to the people in my small group after doing that activity rather than before. So did you feel closer or more connected to the person that you were in the room with after you did that activity? And if you were in the room by yourself, then you probably didn't, but hopefully you were. All right. Well, thank you for putting your comments in there. And we're going to go ahead and move on to the next slide here. So the reason that I wanted to start with that activity in particular is that I wanted to have all of us, let me clear the drawings here. before we get into the topics that we're going to talk about today, which you can see there on your screen, I wanted to have us each just take a moment to reflect a little bit about who we are, and then learn a little bit about someone else who you might be training with. And I wanted you to do this because in your role with patients, whether you're a nursing student, a medical student, a physical therapy student, when you're in a room or in an interaction with patients, a lot of times we don't get to hear the full story that we just shared with each other from our patients. And yet we bring all of our stories into the room with our patients, and our patients bring all of their stories into the room with us. And so when we're talking a little bit today about some of these subjects, I just want you to keep this morning's activity about sharing a little bit about who you are and learning something new or surprising about someone else. Just keep that in mind as we go through today. So the first thing that we're going to do is talk a little bit about some terms that some of you may or may not be familiar with. So what we're going to do is we're going to define some terms: privilege, equity, bias, and then we're going to talk about micro-inequities or microaggressions. So let's start there. So the first concept that we're going to talk about is privilege. And the definition of privilege is something that someone has, a person has, that is special to them, and in particular, that they may not have earned. So it's something special that someone gets access to because of who they are, that they typically did not earn. The best analogy that I have heard of what privilege is this idea of an invisible knapsack or an invisible backpack. This is a concept that was described by a woman named Peggy McIntosh, and she was specifically writing about white privilege in reference to racism. And what she says here is white privilege is like an invisible, weightless knapsack of special provisions, maps, passports, code books, visas, clothes, tools, and blank checks. So it's this backpack that's slipped on our shoulders if we have privilege that allows us to do things easier and have access to things that other people do not. A couple of things I really like about this definition. The first are the words invisible and weightless, because when you have privilege, you often don't know that you have it. You don't feel it. You don't feel that you're wearing the backpack. You can't see it. It's just the way that things have always been for you. You interpret the world as normal, which means that you also assume that the privileges that you have that you're not aware of are given to everyone else. So I want to give you an example of this that is relevant in my life that you might be able to reflect on in your own life. So here in the United States, when I go into a store to buy something, I walk into the store, I look around, I touch clothing that I might be interested in buying, and if I don't see anything I like, I leave the store and I go to the next store. I've never been followed by a salesperson in a store who thinks that I might be stealing something. I've never had people give me suspicious looks when I walk into a store. I've never been asked a question if I've stolen something in a store before. Because those things have never happened to me, I assume that they don't happen to anybody else. But when I go into a store with my friend David, who is Black, he's a Black man, we are followed in the store. The salespeople follow us in the store. They give us suspicious looks, or rather they give him suspicious looks. And what he has told me is that this happens to him almost every time he goes into a store. He is followed by a salesperson. They look uneasy when he walks in. They give him suspicious looks. He's actually been accused of stealing in a store before when he was there with his daughter, with his young daughter, when he was coming to return an item that he had purchased and didn't want anymore. So when I'm in the store with David, what I can feel and see is the backpack of privilege that I usually have. I notice suddenly that this is not my experience, that being followed in a store is not my normal, but it is his normal. And so because of my white privilege, I don't get followed in stores. And I assume that no one gets followed in stores. I don't think of this as special. I just think of it as the way that the world is. This is privilege. So privilege is this invisible, weightless set of things that make the world easier for you, that don't make the world easier for others. So the first step to understanding privilege is really to understand what's in your backpack. And this concept of privilege often makes people feel a little bit uncomfortable. Sometimes people feel defensive or guilty. And while these reactions are common, they're not very helpful. If I feel guilty when I realize that my friend David gets followed in department stores and I don't, that doesn't help David any. What would help David is if I were to work to change the system that makes him followed in department stores. But me feeling guilty or uncomfortable isn't very helpful. These backpacks of privilege that we have, that were slipped over some of our shoulders with whatever privileges we have, we didn't design them. We didn't create them. Other people did throughout history, but we benefit from them. So rather than us spending time feeling guilty about these backpacks that we didn't buy or that we didn't purchase or that we didn't create, but yet we benefit from the privilege, it's more worth our time trying to figure out what's in our backpack, how we benefit from it, and then if we're aware of it and we feel motivated, we can work to undo some of that and lighten the load for other people who, instead of getting the invisible backpack that's helpful and has maps in it and easy ways to get around, they were given a heavy backpack that maybe has rocks in it. It makes it harder for them to get around. So the first step toward understanding your privilege and understanding what's in your backpack is to name these things and name and identify them. So I'm going to do that right now for myself with you. So I'm white. My ancestry is European, largely from Europe. My parents both speak English as a first language and were born in the United States. I come from a mixed class background, meaning some of my relatives are very poor and some of them have more money. I'm the second generation in my family to go to college. My father went to college before me, and I'm the second generation in my family to be a medical professional. My father is a dentist. I've never had to wonder where my next meal would come from. I've never gone hungry. I've always lived in stable housing. I've never had to worry that I didn't have a place to live. I'm able-bodied. I have no physical disabilities that prevent me from doing anything. I'm gay. I'm gender non-conforming, meaning that the way that I present myself in the world as more masculine doesn't fit what people expect from me. I was raised Christian and specifically Catholic. I went to college and I have a professional education as a physician. So those are some of my identities. And some of those identities make it easier for me in the world, and I have privilege because of them. And some of those identities make it harder for me in the world, and I don't have privilege associated with them. The key for me about all of those things is that how light or heavy my backpack is has nothing to do with how hard I have worked. So privilege isn't about your individual effort. You don't get it or not get it because of how hard you worked. I often like to use my own father as an example here. So when I talk to my dad about these concepts of privilege, he often gets very defensive. And he will say to me, my parents had nothing growing up. They were very poor. I have had to work hard for everything that I have in my life. I don't have privilege. And yet, he is white, he is male, he is college educated, he is a dentist, he is Christian, which in this country comes with privilege. And he does have privilege. And it's hard for him to understand. He feels like he has privilege because he worked hard for it. So what I have to do when I'm talking with my father is walk him back through his story. He was born in the year 1949 in a very small town here in Minnesota in the United States. If my father had been born Black in this country, if he had been born a Black boy in 1949 in a small town in Minnesota, he would have grown up experiencing immense amounts of discrimination. he would not have been allowed to use the swimming pool where he eventually became a lifeguard and ultimately a well-respected member of his community. He was featured in the paper after saving a young boy from drowning one time when he was a lifeguard. He would not have had that experience had he been born Black in that small town, because he would not have even been allowed to use the swimming pool in the town that he was raised in. My father then got a scholarship for college. If he had been Black, he would not have been eligible for that scholarship for college. My father fought in the Vietnam War, and when he came back from the war, was given money toward purchasing his first house. If he had been Black, he would have been blocked through the GI Bill in this country from accessing that money to buy that same house. So even though my father has worked hard in his life to get where he is, his whiteness, his maleness, his identities did not make it harder for him. So having privilege is not about not working hard. It's that there are certain things that are easier for you because of who you are that you didn't earn. And so that's this concept of privilege. So if we do the work to understand what's in this backpack that we're wearing, what is the privilege that we have? What are things in our world that are easier for us because of who we are that aren't easier for someone else? What do we do with that? And the best analogy that I have heard about what to do with that privilege is this analogy of a moving walkway. So I'm sure many of you have been to airports and traveled in airplanes. And in airports, there are often these moving walkways or people movers. So you stand on them and they move you in the direction down the airport. You can walk on them and they help you move faster. Or if you don't want to walk on them, you can just walk on the ground next to them. And privilege is like the moving walkway at the airport or an escalator, so that would take you up a flight of stairs. You can walk up the stairs or you can walk on the walkway next to the moving walkway. But if you're on the moving walkway, you'll get there faster. And so as we start to realize our privilege, we have a few choices. The privilege is the moving walkway. It helps us get places easier and faster. We can just keep walking. We can walk on the moving walkway. We'll get to our gates faster than everyone who isn't on the walkway, and we'll continue to live our lives with this privilege that we have. We can stop walking on the walkway. We can stand still. And when we do that, we're not benefiting from our privilege, and other people are walking along the path beside us, but we're not really changing the moving walkway. It's still going forward. We can recognize the privilege that we have and look at those around us who don't have it. And what that would be like is if we were on the walkway and we turned around, and not only are we not walking forward, but we're looking backward. And now what we see is a couple of things. We see all the people on the walkway who are rushing past us with their privilege. The other thing we see is we see all of the people who are not on the walkway, who are walking on the ground, on the sidewalk, on the ground beside us, who are working harder than we are to get to where we're going. And that's really, to me, the first step of wanting to do something about unjust systems of privilege, is seeing the ways that we benefit and other people don't. But the last and final step is probably the hardest, and that is to walk backward, to walk against the moving walkway. So we're not using our privilege to get to the gate faster. We're walking backwards against the privilege. And what that means is two things. It's hard work to push back against privilege because you're walking backward on something that wants to move you forward. And the other thing that it means is that the people who don't have privilege, who are on the sidewalk beside us, they're going to get to the gate first. So when you decide to push back against privileges that you have, it's hard work, and it means that other people can get ahead faster than you, other people who have not had the privileges that you've had. And that's a hard choice to make. And not a lot of people are going to make that choice. But I really like that analogy of using the moving walkway. Think about how we talk about privilege. The next concept that I want to talk to you about is bias. But I am just going to pause there for a second before we go on to bias to see if there are questions about privilege. And Alana, I'll let you facilitate the chat and any questions that people might have before we go on to talking about bias.
No question, and everybody looks fascinated, so you can keep going.
Okay, all right, sounds good. So the next concept that we're going to talk about is bias. And bias is a way that we think or feel or act that we may be aware of or unaware of. So there are two types of bias. Implicit bias. So bias is, at its core, it's a positive or negative thought that we have or attitude or action toward a person or a thing or a group. And bias comes in two types, in two flavors. The first one is implicit bias, and that's something that we're not aware of. It's unconscious. We don't think about it. It lives outside of our awareness. The other type of bias is explicit bias. So that's something that we are aware of and we're doing it intentionally. Now, when most people talk about bias or racism or xenophobia or sexism or homophobia or those types of things, the images that come to mind to them are of explicit bias. They're of people here in the United States who are white supremacists that actively are working to keep people of color from having access to resources. There are people in certain countries who don't want other people to be in those countries, and they're actively working to keep people out. They're people who make negative comments or statements about other people based on their religion or ethnic group. These are the images that we tend to think of when we think about bias, are these explicit examples, people who are open about the beliefs that they have. What we tend to ignore, and what probably drives more behavior than anything else, are these implicit biases. Another way to think of an implicit bias is a stereotype. And stereotypes exist in part for two reasons. One, because they're often true. So I will give you an example about gender. We make a lot of statements that, well, boys are just a certain way and girls are just a certain way. And this person is doing this because they're a boy, and this person is doing this because they're a girl. And the truth is that those stereotypes exist because partly they're true. A lot of boys do these particular things, or a lot of girls do these particular things, but not all boys and not all girls. So stereotypes are never completely true. While they may apply to certain members of a group, they don't apply to all members of a group. The other reason that stereotypes exist is because they save us time. So this t-shirt is meant to be a joke that I have the picture of here. Stereotypes are a real time saver. But the truth is that they are. Our brains have to make so many decisions every second of every day. And in order to make decisions quickly, our brain stereotypes or makes patterns so that we don't have to think about every single decision we have to make. Every single person has bias. If you have a brain that has a consciousness that you are thinking of, you have bias. And not all of that bias is negative, but much of it is. There's a wonderful TED Talk that is done by the woman on this screen, Dr. Eberhardt, that I would highly recommend listening to. But I'm going to give you an example of how bias happens, how unconscious bias happens. And I should say that a lot of the examples I'm going to give to you today are from my own experience and from my life here in the United States. They may be different examples of bias in Israel or in places where you grew up, but I'm hoping that you can make parallels between them. But what I most know is my experience here and here in this country around racism and around gender and around homophobia. So I'm going to give those examples, but I hope that they can help you make some parallels. So here's an example of how bias happens when it's unconscious and when we're not aware of it. So a friend of mine told me a story that when she was a little girl, probably about 5 or 6 years old, she was driving in the car with her mother. And they drove and they were driving and they were talking. And all of a sudden she noticed that they pulled up to a stop sign and her mother reached over and locked the doors in the car, hit the automatic lock button that locked all the doors in the car. And my friend is white. And when her mother did this, she noticed it and it seemed a little bit unusual to her. So she looked out the window. And when she went to look out the window, she was in a neighborhood that she'd never been in before. And all of the people that she saw out of the window were Black people, African-American people. And even though her mother didn't say to her while they were having this conversation in the car, you know, she didn't say, Jennifer, Black people are dangerous. Black people are scary. You should be afraid of Black people. Her mother didn't say those things to her, never said those things to her. But by reaching over and locking the car door, and by her looking up and noticing that when her mom did that, they were in an unfamiliar neighborhood and around people who didn't look like her, she internalized in that moment the message that she should be afraid, and that she should be afraid of the people who were outside her window. And even though no one told her that, that's a message that got into her brain and got into her body, and that eventually she will have to unlearn to not be afraid of the people who she saw outside the window. And there are things like that that happen to us all the time. And some of them are about people, and some of them are just about how we live our life. I'm going to give you a different example that doesn't have to do with racism, but just has to do with how easy it is for our brains to bias us. So I've been driving a car for almost 20 years. And when I learned to drive a car, I learned that when I pull up to a stoplight, the top stoplight is red and the bottom stoplight is green, the bottom light on the stop sign. When the top one turns bright, turns red, I need to stop. When the bottom light turns green, I go. So every time I pull up to a stoplight, when the top light comes on, I stop. And when the bottom light comes on, I go. And I know that red means stop, and I know that green means go. However, I have such a stereotype or bias about what a stoplight does and says and how to interpret that, that if I was sitting at this stoplight and the bottom light came on and it was purple, I would go. Does purple mean go? No, purple does not mean go. But because for almost 20 years, every time that bottom light turns on, it's green and I go, I will go no matter what color that light is when it turns on. That's a stereotype. That's a bias. And I don't even think about what the stoplights look like when I pull up to them anymore because I've been driving for so long. And so it's easy then to see why these stereotypes and bias become so much a part of who we are, because they're things that we've tucked away in the deepest part of our brains that help us make fast decisions that we never spend the time to think about again. And for many things, like the color of stoplights, we don't need to spend time thinking about them ever again. But for some things, like why do I feel uncomfortable around this person? Or why do I feel unsafe in this neighborhood? Or what is it about me that I have a negative feeling every time I have a conversation with this particular type of family or this particular type of person? Those are some stereotypes that are worth looking at. So what I want to, before I take questions about that, I want to take that sort of implicit bias and help us understand how that works in our life, but also in healthcare, particularly, which is why all of us are here to take care of patients. So how that bias shows up in systems in the life that we live in and in healthcare is in inequity, meaning that people get treated differently. And there's different types of inequity, and there's different ways that people are treated differently. One way that people are treated differently is all the way on the left of this screen. It's individual bias. It's ways that one person treats another person differently because of their beliefs. And often that is interpersonal. So that's between one person or another. Sometimes it's one person against a group of people. Sometimes it's one person against a policy, but often it's between two people. But sometimes bias is systemic and creates systemic inequities. And that exists in two forms: within institutions and within entire systems or entire countries. And the example I'm going to use to make this clear to you is that of a banker. So this is the example that Alana can take back to her husband. So I'm going to give you an example of how bias can work for a banker or in banking that will illustrate these different types of inequities. So if I'm a banker and a person walks in and asks me for a loan, and I have a bias, whether I'm aware of it or not, to have negative thoughts and feelings and perceptions about that person. So I'm going to again use examples from the United States because that's what I'm most familiar with. So say that I'm a white banker and the person who walks in to get a loan is a Black person. If I have been taught and seen on TV messages that Black people aren't trustworthy, that they aren't honest, that they don't keep their promises, whatever the case may be, I may make an individual decision to not give a loan at the bank to that person, which may impact their life in that moment, or it may impact the whole trajectory of their life and their family if they're applying for a house loan, for example, because having access to stable housing is something that really can set an entire family up for generational success and wealth. So I might make an individual decision as a banker not to give this one person sitting in front of me a loan. Or if I don't make that individual decision, my bank, my institution, may have policies that make it harder for the person who's sitting across from me to get a loan. So an example of that may be that my bank doesn't give loans to people who live in certain neighborhoods, because historically, those people who live in those neighborhoods have had less access to resources and they experience more poverty. And my bank feels that it's a risk to give loans to people who live in certain zip codes. So even if I, as an individual banker, want to give the loan to the person sitting across from me, there's an institutional barrier in the bank that I work at that will not allow the person sitting across from me access to the same resources because of something about them, in this case, because they live in a certain zip code or a certain area of town. But now there also may be structural barriers, which are even larger than the bank that I work for, that may be a part of the entire banking system in the United States. So let's stick with the thought about house loans. So in the United States, our federal government has enacted policies over the years that prevent Black people specifically from getting access to housing loans. So it's not up to an individual banker. It's not up to an individual bank. The entire government and the entire system has decided that it is going to be harder for certain groups of people to access housing loans than others. So hopefully that's an example that you can see that inequities or discrimination can happen on an interpersonal level, one person to one person. It can happen on an institutional level within a smaller group or a policy or a particular single bank or a single hospital, or it can happen across the entire system and can be structurally built into the way that we do healthcare, the way that we do banking, the way that we do any kind of these policing, as another good example here we're dealing with in the United States. So they're built into these systems. Often what we're going to encounter and what you're going to encounter when you're dealing with patients are something called microaggressions or microinequities. And I want to spend a little bit of time talking about this because this is one of the easiest things for you to change and to pay attention to. It is hard work to change the policies of your hospital. It is hard work to change all of the policies of healthcare to make them equal. It's work that we need to do and that has to be done, but the easy work, the easier work that you can do is this interpersonal work between one person and another person. So I want to talk a little bit about microaggressions or microinequities. So what is a microaggression? These are messages that are subtle, sometimes unconscious messages that we give to people around us that are negative and that either serve to discourage them or impair their access to something, or if they work for you or if they're a colleague of yours, impair their performance. One of the things that I think is helpful is to give some examples of this. And the reason that microaggressions are so important is that we don't notice them, but they build up and they have a big impact. So when you're caring for patients, you may do some of these microaggressions and you don't notice them, but patients feel them. And over time, they will result in worse healthcare for your patients. Or if you're doing them with a colleague, they're small and they're subtle and you don't notice them, but over time, it's going to erode that relationship with your colleague. It breaks connections between people. And they're tiny and they're everywhere, but they do cause large amounts of damage and have a big impact. So what are some examples? So here's the first example of a microaggression. Where are you really from? So the example here is that I was sitting at a dinner table with a colleague of mine. Her name is Dr. Vora. She is Muslim. Her family is originally from Pakistan, and she works with me at Children's Minnesota. And we were sitting at a dinner table with some people who were donating money to our hospital. And we were talking to them about the different areas of work that we do at the hospital and trying to get them to donate money. And there was an older white gentleman at our table who was talking to us. And he said to me, where are you from? And I said, well, I grew up in Iowa. I grew up in Iowa City. That's a city and a state here in the United States. I grew up in Iowa, but I've lived in Minnesota for 20 years and I've been here for a long time. He then turned to my colleague, Dr. Vora, and said to her, where are you from? And she said, well, I grew up in Illinois and I've lived in Minnesota for about the last 5 years. So I'm kind of new to Minnesota, but I'm originally from Illinois. And he said, no, but where are you from? And she said, well, I'm from Illinois. I was born in Chicago. I grew up in Chicago and now I live in Minnesota. And he said, no, but where are you really from? And I watched as, she sort of, her body language changed and she kind of had this downcast look just for a moment. And then she sort of smiled politely and said to him, well, my family is from Pakistan, but my parents have lived in the United States for a long time. They came over as children and I was born here. And that's the answer he wanted from her. But this subtle microaggression and message that he gave to her and the way that he asked that question was, you're different. You don't belong here. And even though the white person sitting next to you was born in Iowa and moved to Minnesota, and you were born in Illinois and moved to Minnesota, there's a difference between you, and that difference is negative. And I don't think that that was his intention. I think that he was honestly curious, and she is different than he is, and he wanted to learn more about her. But the way that he asked that question made it very clear that she didn't belong. So that's an example of a microaggression. Now, how could that have gone differently? So he could have asked her, where are you from? And she could have said, well, I'm from Chicago. And he could have said, that's great. What was it like to grow up in Chicago? And kind of gotten to know her. And then he could say, I'm curious. Tell me a little bit more about your family or your ethnicity. I would love to learn a little bit more about where your family's from or what your history is. And then she could have shared that with him. And that's an inquisitive way of asking that question that doesn't make her feel like she's an outsider or there's something bad or wrong by saying, no, where are you really from? As in, you don't belong here. Here's another microaggression. Microaggression are often formed as compliments. So when I go into a room and speak to people and have a conversation, I have never once been told, you speak English so well, or you're so articulate, or you're so well spoken, because it is expected that I will be all of those things. My colleagues, for example, who are Asian American, are often told, you speak English so well. And they were born in this country. They learned English as a first language, but they are expected to not speak English well, and it is expected that English will not be their first language. My colleagues who are Black are often told, you're so articulate, or you speak so well, because it is expected that they will not. It is expected that Black people are not as intelligent or that they will not speak well. So even in giving what seems like a compliment, oh, you speak English so well, or you're so articulate, the subtle message that is being delivered is, I don't expect that of you, because people like you should not speak English well or should not be intelligent. So that's another sort of thing to think about. Where are those things where we might say compliments, but really it's because we have misconceptions or biases about groups of people that lead us to make those statements. Here are some examples of microaggressions that I've experienced. Who's the real mom? So I mentioned to you that I'm gay. So I have 3 children, and my children have 2 moms. And when our children were little, I have twins who are now 7, but when they were babies, my wife and I would be out with them in public, and we would get asked, so who's the real mom? Well, we're both the real mom. We both spent hours and time, and in our case, money, to create and grow and have these children that we love so much. Now, my wife happened to carry the children inside her body, but that doesn't mean that I'm not their parent, doesn't mean that I'm not their mom, and it doesn't mean that one of us is the real mom and one of us isn't. And I don't think that people are asking that question because they're trying to be mean or they're trying to make me feel like I'm not a parent. I think they're just curious, and probably what they're trying to ask is, which one of you is the birth parent, or did one of you give birth to these children? But what I would ask back to that question is, why do you need to know? Why does it matter? Are my children less my children because they're not biologically related to me? No, they're not. So I think sometimes microaggressions are about systems or things that we have been taught are important that probably are not that important. Does it matter who someone is biologically related to? No, it doesn't. And what that feels like to me, to be asked who's the real mom, makes me feel like I'm invalidated as a parent. And if my children were to hear that question, would also make them feel very uncomfortable, because to them, of course they have two moms, and of course they have two parents, and not one of them is more a real parent than the other parent. Here's another example of a microaggression. Are you sure you're in the right bathroom? So this one's about gender and gender expression and presentation. So oftentimes people who don't meet gender expectations have a hard time using public bathrooms because they don't fit the expectation of what people think they should. When I'm speaking to you, like I am today, I dress up and I wear professional clothing. But if it was Saturday morning and it was 7 a.m. and I have my 3 kids and we're going out to the grocery store, I sometimes wear a baseball hat. And when I'm wearing a baseball hat, particularly from behind, I'm often mistaken for being male or being a boy. And I have, to the point where when I have been out in public wearing a baseball hat, if I walk into a women's restroom, I've had men follow me into the women's restroom because they assume that I'm male from behind. And because of that, sometimes when I walk into the restroom, I am asked, are you in the right bathroom? Now, I'm an adult. I know how to read. I'm very aware of what bathroom I'm going into, and I don't need someone asking me if I'm in the right bathroom or not. But I think these are things that will happen to people who don't fit gender categories that make them feel unsafe using public bathrooms, that will make them make decisions like going to the bathroom. Even children will hold going to the bathroom at school if they don't feel comfortable, and cause them later health effects in life. So again, these are just sort of 4 examples of small things that we can do that are negative sort of microaggressions that build up over time that aren't explicit. They're not people saying, you're different, I don't like you, you don't belong, I'm better than you, but those are the subtle messages that they're giving. So how does that translate into healthcare? When we don't recognize our privileges, when we don't recognize the biases that we have, what happens is that when we walk into a room with a patient, there is this huge elephant in the room that is coloring and impacting every single interaction that we have with a patient. And you can believe me that that's true, or you can say, you know what, Dr. Gefford, I don't believe you. I believe that I'm an individual who makes my own decisions, and every time I walk into a room with a patient and family, I know that I am treating them right. It doesn't matter who I am or what privilege I have or where I come from or what biases I have. I know that I am treating them well. And so I'm going to give you some information that might make you second guess that assumption. So here in the United States, we have done studies about this. In fact, there was a whole large book that was published by the Institute of Medicine called Unequal Treatment that talked about these racial and ethnic disparities that we have in healthcare, that proved to us that even though we're good people, even though we want to do the right thing, even though we love the patients that we're taking care of and we want to help them be healthy, that our biases are getting in the way of us providing effective healthcare. And I'm going to give you a few examples from this study. When patients come into an emergency room and they're having symptoms of a heart attack, whether or not they get referred for cardiac catheterization is absolutely different based on their race and their gender. If you are a white man, you are significantly more likely to be referred for a life-saving cardiac catheterization procedure than if you are Black or if you are a woman. And if you are a Black woman, your chances of getting referred for cardiac catheterization are much lower, even if you have the exact same symptoms of the white man. If you're the same age, you have the exact same symptoms, you're much less likely to get referred for the life-saving procedure. Medical students in this country, when we ask them, believe that Black patients tolerate pain differently. There is no scientific evidence that any race of people tolerates pain differently than any other race of people, but they have internalized subtle messages over time that make them believe that Black patients have a different pain tolerance. So what happens then and how that translates is that when we do studies about access to pain medication, which we've done at our children's hospital, even in Children's Minnesota, where I can tell you, for those of you who've never been to Minnesota, we think we're the nicest people on the face of the planet. We are just nice people here in Minnesota. But in our emergency department, we've studied ourselves. And when a child comes into our emergency department with a long bone fracture, with a fracture in their bone, it takes more time for us to give pain medication to the Black children than it does to the white children, or to the Native American children than it does to the white children. So when we've studied this, time to pain medication and even getting the pain medication in the first place is significantly longer for both Black and Native American patients. Doctors will rate our Black patients as less intelligent, less educated, more likely to abuse drugs and alcohol, and less likely to comply with medical advice compared with other patients. And that's before knowing anything about them. So these are all stereotypes and biases that we carry with us that are impacting our care of patients, whether we like it or not. And there was a study that was just published in Pediatrics Journal this year. Actually, this research was done in Minnesota. That as much as we like to say that we're all good doctors, we're all good nurses, we're all good physical therapists, we all provide the exact same care to patients, regardless of their race or their ethnicity or their religion or their sexual orientation. We know that we have a difference in this country, in the United States, of infant mortality. So Black babies are more likely to die than white babies, and Black mothers are more likely to die in childbirth than white mothers. But when those babies are cared for by Black doctors, they do better. And so that just is another example that reflects back to us that even though we think we're doing the right thing, we're falling short and we have work to do. Now, that it doesn't just apply to race. So I'm going to give you some examples around sexual orientation here in this country. So people who are LGBTQ, who are gay, lesbian, bisexual, transgender, are afraid to tell their doctor about their identities because they worry that their doctor will treat them differently. And they are right to worry, because when we do studies, LGBTQ patients in this country are more likely to experience not just bad care, but actual verbal harassment and physical abuse in healthcare settings. 1 in 4 LGBTQ people experiences this in our healthcare system. Transgender patients not only report experiencing physical abuse, but 6% of them, this was a study that was done of college students in Wisconsin, a state here in the United States, 6% of them have been sexually abused in healthcare. And when we look across health outcomes, access to care, appropriate medical screenings, things like screening for cervical cancer and breast cancer and heart disease, and access to mental health support, LGBTQ patients will rank lower in all of those categories compared to heterosexual or straight patients. So it's not just about race, at least here in the United States, it's also about sexual orientation. Now, I don't live in Israel and I don't practice medicine where you all live and work, but I do know that there are racial and ethnic biases that are in Israel that are different than are here in the United States. Some are the same and some are different. I don't have data specifically about healthcare, but I do want to share with you some data that I was able to pull when I was researching for this talk, to just give you a chance to reflect on biases that may exist where you are that may impact your care of patients.
Angela, before you start the examples you wanted to give us, there is a discussion in the chat, and I want to share some questions that arose with your presentation. Some of the students asked about, do we have data about it in Israel? And I'm sorry to say that I don't know of such data about the outcomes of children with different ethnicity groups, but it is definitely worth a study. and about they also, some of them must might it be the same in Israel, and if we don't have a lot of black population, we have the Ethiopian population. And what I wanted to comment is, ask and comment, as how do you think it reflects on, let's say, how it might be reflected in Israel population, as as you found, as we discussed about the Israeli unique cultural diversity.
That's a great question. So what I would probably say, because I don't live in Israel and I didn't grow up there, is that if you think about it, you probably know, and I'm not asking you, Alana, I'm just asking the students. If you reflect, when are times where you were driving in the car with your parent and someone locked the doors? Where were times where you got messages about certain people who are different, who are dangerous, who might be less than human, who should be treated differently, who should be denied access to participating in government, to voting, to housing, to employment? What are messages that you have gotten in your life about different groups of people that have been telling you that those people are deserving of less than you are? And so you can there are probably words and images and different groups of people that are coming to mind as I'm saying those things. And what I'm going to share with you on the next slide is some of the examples that I was able to come up with that might make you think about those differences. And while the examples I'm going to share with you are not about healthcare, I can guarantee you that they will extend into healthcare. So any bias that we have about another group of people will impact the healthcare that they receive. So while it might not be Black patients and white patients in Israel, it might be Arab patients and Jewish patients in Israel. The differences that you experience are going to extend into the care that you provide to patients. And so it would be, I would love to have someone who has expertise in that area share those differences with your teams and talk about that, because I'm sure that they do exist. So this is what I'm going to share with you. So this was a study that I found in March of 2010, where they asked high school students, and half of Israeli Jewish high school students believed that Israeli Arabs should not be entitled to the same rights as Jews in Israel. So that's a belief that high school students have. And anytime you have a belief that someone is not deserving as much to things as you are, you're going to treat them differently. So you might give them pain medication less quickly. You might prevent them from accessing a particular medication. You might not spend as much time in the room with that family, listening to their story and understanding where they're coming from, because you have a perception that they're different. In 2008, this Advocacy Center for Arab Citizens reported a 10-fold increase in racist incidents against Arab people in 2008. So again, what that tells me is that if there are racist incidents happening that are being reported, they're probably also happening in healthcare. Here's another study about attitudes. And so this was in 2009, that 35% of Israeli Arabs said that they don't have a good or favorable opinion of Jewish people. And 56% said that their opinion was favorable. So again, what that tells me is that there are attitudes that certain groups of people in Israel have about other groups of people. These are biases that people have that are going to impact the way that they interact with and care with those people. Regardless of who they are, they're holding on to these perceptions. And then with regard to LGBTQ people in Israel, this was a 2014 study that 50% of lesbians, 20% of gay men, and 80% of transgender people experienced discrimination when they were seeking jobs, when they were seeking to be employed. So again, this isn't a study about healthcare, but I would probably guess that if 80% of transgender people and half of gay people are experiencing trouble when they're trying to get jobs, they're also probably experiencing trouble when they're trying to access healthcare. So again, these are just sort of some large picture numbers that I was able to find, but I would invite you to reflect on how that might show up in healthcare and in how you're caring for patients. And I'm very sensitive to the fact that I'm speaking to you as someone who is from the United States and doesn't live in Israel. So I don't feel like I have a lot of authority to comment on these differences and these racial and ethnic differences. What I feel like I want to do is just reflect back to you some information that I, as an outsider, was able to find, to just get you to think about them a little bit and think about all of these topics that we're talking about in terms of privilege and bias and microaggressions and how they might show up in your life and in your world that might be a little bit different than how they show up in mine. Alana, is that helpful?
Yes, I think you're steering a huge discussion in the chat room. There is an issue. I think maybe you will be the person to address. Some of the comments are that it's very understandable that when we close our cars, lock our cars, in face of a person which looks like a threat to me, it's very understandable. If I'm in a car and I'm afraid of the person outside, I think the problem is that the generalization of the situation, and it's hard for the human mind to keep all the possibilities in one ethnic group. Like we are really struggling to deassociate some of the associations we have with negative feelings of fear with the person.
Of fear, right.
And we have a lot of fear, I believe, in the States too. When you're talking about Black and white people, it's not different than we have here in Israel. It involves a lot of fear. The white people are not bad people by definition. They might be afraid of several Black people that made some actions of violence and steered. This is what I want you to comment.
Yes, I appreciate that. And that's a very good question. And it is very complex. So I'm going to give you an example. So I could go on and on about police violence here in the United States. So I'm not going to do that, but I'm going to give you a different example that is about a personal story for me. So people ride bicycles here in the US, and I'm sure in Israel as well. And they're riding bicycles all over the place. And when I see a white person on a bicycle who has something in their hand, so for example, they're bicycling toward me and they have something in their hand, I almost never assume that what they have in their hand is a gun. And when I was driving home from work last summer, I was driving down the street and there were two Black men who were biking toward me. And one of them had something in his hand that he was holding up by his head, and it was dark and I couldn't see what it was. It was light outside, but the object in his hand was a dark object. And the very first thought that I had in my brain was, he has a gun. Now, it is far, far more likely that what he has in his hand is a cell phone. And in fact, as I drove closer to him, I could see that what he had in his hand was a cell phone. And if he had been a white person, I would have assumed that what he had in his hand was a cell phone. But because he was Black, my brain made me scared and made me afraid that what he had was a gun. And why? Because I have seen images on TV and in movies of Black people with guns, and they have been perceived as being dangerous far more. Because Black people who live in this country have lived in poverty for years and years and have had been denied access to employment and housing and other resources. And people who are Black who live in those poor neighborhoods, some of them are drug dealers, some of them have guns, some of them are very scary. And here in Minneapolis, where I live, there are scary Black people who have guns that I should be afraid of. However, that gentleman who was riding his bicycle toward me with his cell phone in his hand deserves for me to not be afraid of him, because he has not done anything to make me afraid of him. Even if I have these stereotypes in my mind that sometimes are based in fact and reality, it will cause me to be more afraid than I otherwise should be. And I can make certain decisions when I'm out in the world if I'm going to lock my doors or not lock my doors. But when I'm in a room with a patient, I'm the doctor. I have the power I'm making the decision, and I need to be extra careful that I am taking my time to make sure that I'm interacting appropriately with the person in front of me based on who they are and what the information is they're bringing to me, and not a stereotype that I have in my head about them, even if there may be some reason that I am afraid of that. So if there are individuals that are perpetrating violence in the neighborhood that you live, you should feel afraid. That's an absolute reason to feel afraid. But to assume that every person who looks like that will be a violent person is an incorrect assumption. Is that helpful, Alana?
Yes, I think so. Thank you. I
Okay.
think there was a previous comment, a question about the escalator and walking in the
Against it?
contra way of the escalator and the effort it needs in order to clear our mind of previous assumptions. We have to work hard on that. And the question of the student was, how does it help us to work against the escalator? This is the work against the escalator. This is the work bringing to your mind awareness of having this influence without having knowing about it. You don't know you are influenced by that.
Right. So what I'm going to really spend the last 10 minutes of the talk talking about is how we undo some of this. What are some tips and techniques and strategies that we can use, particularly because we are all going into healthcare and we all want to provide really good care to patients, that we can use to undo some of this? So that's what I'm going to spend the last part of the talk talking about. Just two brief points that I want to make before we get there. Often people get stuck on bias versus racism. So I just read you some studies about feelings that Jewish people in Israel may have about Arab people in Israel, and feelings that Arab people in Israel may have against Jewish people. So people have biases against each other. They're different when one group has power over another group. So white people in this country may have bias against Black people. White people also have privilege, and because of that, they're more often in positions of power to do something negative to groups of Black people because of that bias. Black people in this country may not like white people either. They may have a lot of bias against white people, but there's nothing that they are doing with that bias or have access to do with that bias that will limit the privilege or the possibilities for white people. So there is a difference between just having a negative opinion of someone and being in a position of power to exact negative outcomes for that person. There's also a big difference between individual versus system, which we talked about earlier. And one thing that you can think about when you're taking away from this talk, I think about it, is I like to think of systemic racism or systemic bias as the wiring in the walls. It's in there. It's in our healthcare systems. We don't see it. It's making everything go. Think about this one idea. Every system is perfectly created to get the outcomes that it gets. So our healthcare system in the United States is actually perfectly created to get the outcome that Black babies and Black mothers are more likely to die. If we don't want that outcome, we have to change the system. We have to uncover the wiring in the walls. And that's something that we're going to have to do to change that outcome. It's not enough for us to not want that to happen. We have to actually change the wiring to make it not happen. So how can we do that? What we want and what we're working for is health equity, where everyone has the possibility to live up to their full health potential. We don't just want equality where everyone has the same, because as you can see here, if everyone's different heights and we give everyone the same box to stand on, this short person still can't see over that wall. What we want is equity, where people who need more get more. The shorter person gets more boxes to stand on. The medium person gets one box. The outcome is everyone can see over the wall, but we're giving different resources to different people. What I would argue would be even better is justice. And justice is where we just take down the wall. We figure out a different reason. Why is this wall here? Well, we don't want the ball coming across. Does the wall have to be wood? Does it have to be something we can't see over? Well, no, it doesn't. Let's just change the wall. And if we change the wall or we change the system to make it a much more just system, then we don't have to worry about giving extra boxes to anybody because everyone can see. So this is sort of what we're working toward. So how do we do that? We have to work to overcome our biases. And the first thing we have to do is understand and name them. And so that's what we spent some time talking about at the beginning. If you want to learn more about your biases, I would invite you to take the implicit association test. You can scan this QR code on your phone, and I'll send a PDF of these slides to Alana that she can send out to people so you can get that as well. But there are different tests that you can take online to find out where your biases are. And these were developed by Harvard here in the US, and you can go through and take some of these tests. The other thing is that you have to develop strategies to mitigate your biases. So I like to think of these as guardrails on a road. If you know that you're always more likely to pull your car to the left and that your car is going to go off the road because you're more likely to turn your car to the left, you can work really hard to stop turning your car to the left, but that may take some time. But you could put a guardrail up so that when you do turn your car to the left, you don't go barreling over the cliff. So what's an example of this? I'm going to give you an example of healthcare. Let's take those kids with the fractured bones, the ones where the Black kids don't get the pain medication as quickly as the white kids. I can tell the emergency room doctors, we studied your outcomes and we know that this is what's happening in your emergency department. I want you to change it. And they may try to change it and they may have good intention, but because they've always done it a certain way, they're likely to drive their car off the road again. But if we put guardrails up, like in our electronic medical record, every time a patient checks in, we check their pain level. And if they rate their pain level at a 5 or higher, there's a timer that triggers in the electronic medical record that that patient needs to get a pain medication. And if they haven't gotten a pain medication, there will be an alert that will fire to make someone get them a pain medication. That's a guardrail. So that prevents, it takes out the human error. It makes it more certain that people who are in pain are going to get pain medication. So that's a guardrail. So we can put up these guardrails to help us do better. Some things we can do are always or never. So we always do something a certain way or we never do something a certain way. We find commonalities between us. That was the purpose of the I am from poem. We learn ways that we might be the same as other people. We consider the opposite. If I was driving my car and I saw someone who was Black who had something in their hand and I thought it was a gun, for a second I could consider, what if it's not? I could consider the opposite. You can counter stereotype. If every image I'm always seeing of someone is negative, of a certain type of person, I can go looking for the positive images so that my brain is not always seeing the negative ones. These are called counter stereotype exemplars. And again, standardizing your practice and your routine, like the example I told you with the pain medication, as much as we can standardize things, the better we will do. So I talked about always or never. There was a study that was done that when people who were interviewing people for jobs had a cup of hot coffee in their hands, they were more likely to rate the person they were interviewing more favorably and give them the job than the people who they interviewed when they didn't have the hot cup of coffee in their hands. So if you want to make good decisions, do something always or never. When you're interviewing people for a job, always have a hot cup of coffee in your hands or never have a hot cup of coffee in your hands. And that way, the coffee won't be making the decision. And so it's the same in healthcare. If you're going to ask someone, where is your family from? Always ask them or never ask them. So you have standard ways that you do things where you can be always or never asking people these things. Expand who's in your life, expand your social network. The best way to overcome your biases and stereotypes that you have about people is actually getting to know people who are from that group of people. Who's in your social network? Who do you spend time with? Who are your people that you spend time with in school or at work? And when you become a nurse or a doctor or a physical therapist, who are you mentoring? Who are you helping? Who are you bringing up? Who are you pulling onto the walkway with you to get there as fast as you did? So how are we doing that? There's a book that was written by an author here. her name is Robin DiAngelo, and the book is called White Fragility, and it talks a lot about racism in the United States. But she gives the example of a wedding. Because oftentimes we'll say, well, I have a Jewish friend, or I have a Black friend, or I have a gay friend. But what we're really trying to say is, I know a Black person, or I know a gay person, or I know a Jewish person, or an Arab person. Who was at your wedding? Or who would be at your wedding? Who is at your birthday party? Who are those close people? That's who you want to expand. Not just the people that you know, that you can say, I know this person or I know that person. Who are you developing trust with? Who are you getting to know on a deeper level? Those are the social networks that we want to work to expand. Slow down your thinking. Stereotypes are for fast thinking. They help us make really quick decisions. And when we make really quick decisions, they're not as accurate. We have to be able to make really quick decisions in dangerous situations or in situations where we do them over and over again. But if we want to make accurate decisions, we need to slow down our thinking. When we make fast decisions, what we're doing is we're scanning our environment, we're making a quick decision. It's fast, but it's prone to error, and it relies on our intuition and our impulses, which is sometimes good and sometimes rooted in bias. If we want to make good decisions, we need to slow down our thinking. This takes more time, it's harder, but it's more reliable, and it will allow us to make better decisions. So slow thinking is another way to overcome our biases. And then the last thing I want to invite you to do is to walk boldly toward your biases. There's a beautiful TED Talk given by the woman on the screen. Her name is Brene Myers, B-E-R-N-A-M-Y-E-R-S, Brene Myers, in which she invites us to overcome our biases by walking boldly toward them. Find out what your biases are and then work to undo them. What I'm hoping that I've given you the opportunity for today is to see the water you're swimming in, to not be a fish that's just swimming around, not realizing that you're in water, but to look around you and see what is the system? What are the systems? What are the biases that I've been influenced by? What is the privilege that I have? So you start to see the water that you're swimming in, and that's the first step. And then the next step is to realize that there are some choppy waves of racism and bias that are causing negative outcomes. And if you want to do something about that, it's not going to be easy. And you're going to feel at times like you're being thrown around by the waves in the sea. But what I'm hopeful for is that you can do this with each other and that you won't be out there alone. And I can guarantee you that I'm out there with you and I'm doing this work every day. And that if enough of us are in the waves together, we won't drown, then we'll get through it. And together we'll be able to ensure that we can not only make sure our patients get the best care possible, but we can create the kind of world that we want, where everyone has equal opportunity and access to seeing over the fence or seeing through the fence or seeing whatever it is so that we can achieve justice. So thank you. It's 9:30. I want to stop there and be respectful of time. And Alana, thank you so much for the invitation today. I really appreciate it.
Thank you, Angela, so much. It was very, very powerful. The students shared their feelings and thoughts at the chat also, and they were inspired by our talk. And I think we have we don't have any time for questions, but there was during the talk there was questions, and they are writing thank you, and it was very inspiring, and I'm happy to communicate that to you, Angela. Thank you very much. Orly, do you want to say a word? I saw Dr. Koifman here and Professor Eli Lewis. We will be happy to have you talking to.
Yes. Orly first.
No, Eli first. Louis first.
Oh, Orly. Oh, Orly. I just said that I was fascinated and glued to the screen. And I'm so happy that the students get this opportunity to get the bigger picture and so much insight. And I really hope that we can carry the message further. Oli.
Oli?
So, Angela, really thank you. It was fascinating. And I think it is a very important for our students. And it's like the beginning of thinking how to change things inside the healthcare system. So really, thank you very much.
Yeah, absolutely. Well, thank you for the invitation. And I will be sending some articles that people can read after today if they want to learn more. We didn't want to send too much at the beginning to overwhelm people, but there'll be some information coming after. And I will send a copy of the slides, a PDF of the slides, if people want to reflect on what they heard today afterward.
Wonderful. Angela, one more thing. I think one student wanted to ask question. Do you want to speak up? Who asked me about if it's possible?
Yes, me.
Yes, Gilit.
Firstly, it was very interesting and fascinating. So thank you very much on the time. I have a question about the privilege. You say that we need to go against it. How did it will help us? The world is very many things that have someone and someone don't have it. How it will help me to kind of stop me for something I can do and go to my succeed faster. Sorry about my English.
Yeah, no, I understand what you're saying. So how would it help you to go against the walkway? And I think for me, I can speak for me. When I'm walking against the walkway, it doesn't feel good. It's hard work. It's uncomfortable work. But what I see in the world around me is not a world that I love. It's not something that I want to continue. And so I'm willing to tolerate my own discomfort so that other people can be free and so that other people can experience liberation. And that's just a commitment that I'm willing to make. And not everyone is willing to do that. And I think at a very minimum, what I would love to see is people turning around on the walkway to see the differences that exist between us so that they can inform their decisions when they're voting, when they're taking care of patients. But it does not feel good to walk against the walkway. The system is designed to keep getting the outcomes that it has. And so when you start to work against it, it doesn't always feel like there's something in it that's good for you individually. But for me, the piece that I get in doing that is knowing that I'm changing the world or the larger system in a way that I want to see. And so I'm willing to tolerate how uncomfortable it feels for me so that other people might live to be more free or live in a more just society. So I don't know if that is a helpful answer, but that's probably the best I can think of.
Yeah, I understand. Thank you. And what about the bias that you say? I think it's a nature of people to not agree about things and have some opinion. And if I say I'm a Russian and I speak Hebrew, and some people will see me and it's stranger that I speak good Hebrew, but here I born. So it's logical to think that I don't know, don't need to know it, no? It's how I choose to see it, no? To think about what happened.
Yeah, I'm having a hard time both hearing you and understanding the question a little bit, but bias is hard, and we both act on bias and experience bias. And I think when you're someone who experiences bias for some reason based on the way that you are in the world or the way that you speak or whatever it is, I think that the best way to handle those situations, or at least the way that I handle them when I encounter bias, is to remind people of my shared humanity with them, to find things in common with them so that they see me as a person and not as something that is different about me. So not as how well I can speak a particular language or not whether I'm a gay person or not, but that I'm a parent just like them, that I'm a person who has feelings just like them, that I get along with and don't get along with my family, just like them. So finding shared points of connection, I think when you're a member of a group who experiences bias, is one way to help people who have bias against you overcome that.
So it is to know the people and not judge them.
Great.
I agree to this. Thank you very much.
Yes, yes.
It's a good way to conclude our meeting. Thank you, everybody that stayed until this. It's quite late in Israel. It's only the beginning of the day for you, Angela, I believe.
Yes, it is.
So thank you, everybody, for being here and for the really thought-provoking talk you gave. Angela.
Thank you very much.
Thank you.
Yes, thank you.
Thank you.
Thank you so
Really
much.
appreciate this
Great
talk.
weekend,